York. There's no other city like it in the world. It's a city of contrasts and endless variety, embracing all races, all cultures, all creeds, on the streets and in the canyons of 1,000 different neighborhoods. A city of sound and movement, New York is an incredible mix of people, of promise and problems. You know, too often in our city, we become so caught up in the daily rush of living that we are never really aware of all those thousands of people who touch our lives each day. New York can be a lonely place when you're old or handicapped, when you're sick or alone and unable to reach out for help. And as life grows more impersonal and complex, our need for person-to-person help becomes even more compelling. We need to be tended when we're ill, to be comforted when we're alone, to be helped when we can't help ourselves. Sometimes what we need most is to reach out and touch someone. But no matter how large or complex the city may be, there are always some very special people willing to devote their skills to giving that kind of help. People like the visiting nurse, who brings comfort and help and caring to every New York home.
Home to a New Yorker can be an apartment in the South Bronx, a pad in the Village, a brownstone, Gramercy Park, a row house in Queens, or a single room in an old West Side hotel. The visiting nurse is familiar with every section of the city. It is here that you'll find her helping people cope with illness and the problems of daily life, teaching people how to live with their handicaps in order to survive, reaching out into every neighborhood. Nursing, counseling, helping the new mother, the poor, the disabled, the elderly, the drug addicted. The Visiting Nurse Service is the largest nonprofit public health nursing agency in America.
Good morning. This is Ms. Keelty with the Visiting Nurse Service. How are
It's
you?
a multi-service agency, providing a wide range of vitally needed, comprehensive care. But the problems of providing home health care are mounting. In New York, as well as throughout the United States, the population is increasing. We are living longer, and we are becoming more aware of people's needs. And no one is more concerned with this problem than the Executive Director of Visiting Nurse Service of New York, Mrs. Eva M. Reese.
We're seeing in New York City the same kinds of problems that I think exist all across the country. Perhaps we see more of them because we're a larger city, and ours is a large agency. But unless home health services across the country develop a range of services that can really be meaningful to people in getting their health needs met outside of institutions, the whole country is going to be in very serious trouble.
Hospitals throughout America know the problems of their communities, and New York has 130 community hospitals. One of these is Columbia Presbyterian, located in the Washington Heights section of New York City, where last year their Vanderbilt clinic had over 400,000 outpatient visits.
This community around us of some 300,000 people, in the last few years, the physician population has dropped from over 200 physicians down to less than 50 physicians. And I might say in a community in which it would appear that the medical needs have increased.
Director of Vanderbilt Clinic, Dr. Joseph Snyder.
We've been doing our very level best to take care of all of the people, and so far as possible. But there's just too many of them out there with just too many difficult needs that we just can't take care of everyone, and we need help. We need all the help we can get. We here in the clinic need to have that arm out in the community. I have no hesitation in saying that we could not take care of as many patients as we do if we did not have the services of visiting nurse. The visiting nurse is the source of a great deal of comfort and a great deal of strength for the patient and a great deal of peace of mind for the physician.
Good. That's good.
The difficult task of providing home health care every day for thousands of New Yorkers is a demanding and often frustrating job. requiring extreme dedication.
Once a day.
But it's the kind of challenge Visiting Nurse Service of New York has been facing daily for over 80 years.
It seems looser than it has
I was
been.
just going to say, it looks
Yeah.
great today.
Yeah.
Much better. Well, yeah.
This long history of service to the city's people began when New York was the teeming gateway to America for millions of immigrants, many of whom settled in the crowded tenements of the Lower East Side. It was here, in a house on Henry Street, that Lillian Wald, a young nurse, founded what is today Visiting Nurse Service of New York. Inspired by her courage and dedication, thousands of nurses have followed in her footsteps, alleviating the pain and suffering of hundreds of thousands of men, women, and children. Times have changed, and neighborhoods have changed, but the human needs of people remain the same. Today, field staff members of Visiting Nurse Service make more than 400,000 visits a year to people in need of care. Their visits take them into the city's most disadvantaged slums, to middle-class neighborhoods, and into the wealthiest sections. For Visiting Nurse Service of New York is for everyone, whoever they may be, young or old, married or single, whether or not they can afford to pay. Wherever the visiting nurse goes, she must be resourceful enough to handle a variety of problems. In the home, she confronts loneliness, poverty, and poor nutrition. And a big part of her job is helping people to organize their lives, teaching them how to help themselves as well as each other. Carol Brown visits 6 or 7 patients a day. She helps to rehabilitate the handicapped, teaches diet and nutrition, and works with doctors to carry out an effective plan of care. Her caseload runs the gamut from geriatric patients to the young man or woman living alone who broke a leg in a skiing accident, or the instruction of a new mother in the care of her baby.
In the hospital, people come to you stripped of essentially everything they are, except for being a patient. They're not in their own environment, they're in your environment. And in the home, this is where they live, this is how they live.
Sit down, honey. How have you been feeling? We'll talk to Miss Altieri.
This is them, and I think it's real, and I like it.
Straightening up and things like that. And I'm not able to shop because when I was going, me and this big shopping cart, I guess that was too much.
Yeah.
At a time when families are scattered and neighborhoods are changing, a visiting nurse like Renee Vasallo is more than a nurse.
How do you do these days?
She is like the daughter who lives halfway across the continent, the neighbor who moved away. She is a friend.
When I spoke to you on the phone before, you sounded very close.
Yeah, I was coming up the stairs,
Oh.
and I was, I'm a little in.
Are you taking it easy?
Yeah, I take it very easy, very slow.
Okay.
Very easy, very slow. When I walk, I gotta be slow because I haven't got the strength yet.
Okay. Mr.
Gotta
Troll.
walk slow.
Hi.
How do you do?
How are you today?
Oh, not too bad.
Are you having any trouble with your breathing?
Well, when I walk the stairs, Otherwise, it's
Any
pretty bad.
coughing?
No, so otherwise, no coughing. But once in a while,
Are you bringing anything up when you cough?
Yeah, I do.
A little bit?
A little bit, yes. So there's nothing, just white flames and things like
Okay.
that.
If there's any changes, if you
Yeah.
find that you're having more trouble breathing
Yeah,
or that
yeah.
you're coughing more, let me know so I can
Okay.
contact the doctor.
All
Because
right.
the last time you went back into the hospital when that happened.
Yeah, yeah.
I don't think it will, but just in
I
case.
hope not, I hope not.
Okay.
Well, so far so good. I said, God was with me. I had a wonderful hope from him and from the doctor. I had a good doctor. And so far, I'm on my feet. That I can say in 9 months. On my feet, and I can do little things, not much, but I go around, Every day a little bit. Every day a little bit, and time this passes the week.
Have you gotten any tingling or pain in the foot of the hole?
The visiting nurse becomes involved in the lives of people in a way that few professionals can.
Exercise, that muscles here. Here, the tongue.
She plays many roles. One of the most important and most rewarding is that of family substitute.
Okay. It's good.
Oh, let's hope so.
Okay.
I had my share from everything, so I'm praying to God that comes something better.
Okay. Should I come back Friday to see you?
All right.
Mr. Troll?
Then Mr. Brody can see. Fine.
Okay.
Anytime, then you.
Well, when you make the strudel, I'll definitely come back.
Not
Whether you
this
need me
week.
or not at that point, I'm coming back.
Not this week yet. I have to walk too far to the Patsy.
This is Mrs. Colony from the Visiting Nurse Service. Yes, it's a nurse story.
Geraldine Polony starts her day, as all visiting nurses do, in a local district center.
What about your medication?
Have my stethoscope in here today? Oh, I think being a visiting nurse, you can offer them more of yourself, more of care, more of your attention, more of your professional abilities, and therefore they do receive more. They receive much more on a very individualistic level.
All right. Whenever you're ready. I'm ready.
I'm ready now.
All right. Okay, just stand there for a second.
The visiting nurse is often the only person bringing hope and happiness to the lives she touches. Sometimes their only contact with the outside world. This holds particularly true with many geriatric cases. But she also plays an important part in providing proper care for a new life.
Are you left-handed or right-handed? Right-handed. Oftentimes the best...
Each year, thousands of expectant mothers and new mothers receive instruction and guidance in the care of their infants.
You're a little chilly. We're almost through.
During visits to the home, nurses like Sarah Lapine are trained to observe and evaluate any physical, emotional, or social problems that may affect patient care. In the majority of cases, she is equipped to handle such problems.
Well, many times there are social problems that the parents are trying to deal with. And this is when you turn to your social worker and ask him to make a visit to find out what's going on, to see if we can be of help in this area, whether it's housing, whether it's dealing with different city agencies. But this our social worker takes care of, or tries to.
Often a patient's pressing health problems are intertwined with social and economic circumstances.
Accompanying you when you go. I spoke with a lawyer from Legal Aid, and
together with the other professionals of visiting nurse service, he works to ease the physical,
and they're not going to be recouping that money from your check.
the emotional, and the environmental conditions that affect people's lives, bringing them the resources to help them get through difficult times.
Have you had any difficulty?
To meet the needs of the community, visiting nurse service has broadened the range and scope of health care, adding to its staff specialists in physical therapy, rehabilitation, and speech therapy, specialists in mental health and nutrition, and the family nurse practitioner, who has special training in physical assessment and management of patient care. She is a valuable link in the visiting nurse program of cooperation with hospitals, ministering to patients after they are discharged. Visiting Nurse Service of New York recognizes that home health care is only part of the solution to the increasing health needs of its community. They are also reaching out to the walking sick and the walking worried, too, in centrally located places, like the one at the George Washington Bridge bus terminal. Under the guidance of a dedicated board of directors, special committees, and volunteers, they have established a program of reaching out to people in a variety of settings, bringing help and aid to clubs for troubled youths, shelters for homeless men, schools for unwed pregnant girls, drug addiction centers, and single-room occupancy hotels.
I had a little cottage cheese with a couple of peaches.
At the very heart of the visiting nurse service is a philosophy of true concern for the needs and problems of people, whoever or wherever they may be. A strong desire to reach out and help on a personal, one-to-one basis. It's hard work, demanding, and sometimes frustrating. But not without its rewards and personal satisfaction, which can be found every day in the eyes of thousands of grateful patients. It's a service that requires people who are not only trained in their profession, but have a concern and compassion for their fellow man. truly a special breed, highly motivated to help in every way they can. Like Nurse Olga Perez.
The reason I primarily went in was to teach the mother how to take care of the little girl with the spica cast and to perhaps show her some ways, since this limits the little girl's movements, to show her some ways in which she didn't have to be so limited. You're trying to teach people how to stay well, to give them preventive care, which is the kind of information that they need to be in the home, to be independent. It wasn't easy because there were just so many other problems. I mean, this wasn't the only thing. You come into the house, there was no furniture, the apartment was sadly in need of repairs, the mother pregnant, and then there was a little boy who had club feet, and there was the other child who had pneumonia, which kept reoccurring. So it was like from one thing to another. She could spend the whole week just making clinic appointments, never mind trying to manage a home with 3 very active little children. The mother was warm and caring, and it was like the kind of home you walk in and you say, oh, they deserve everything, and you wish you could do everything for them.
Nurses like Olga Perez, Sarah Lapine, Geraldine Polanyi, and Carol Brown are just a few of the great many concerned people who comprise Visiting Nurse Service of New York. It is through the efforts of Visiting Nurse Service of New York and agencies like theirs that the importance of home health care is being recognized throughout America. But the ability to provide the broadest range of home health care requires volunteers, public contributions, medical science, and social services, all working together to help meet the needs of our society.
In a hectic world, we are often lost in the preoccupation of earning a living, making a life. And the dedication and devotion of the visiting nurse to the needs of others is a lesson to us all. We never know until it strikes home how illness or handicap can change the life, our lives. We never know when we ourselves may need the helping hands of others. Through its inspiring program of service to people, the Visiting Nurse Service of New York reaches out and touches us all in time of need.